Next presenter is Dr. Saroj Gupta. Free paper number 392, Protective Behavior of Time Spent Outdoors on Myopia Progression in Children.
A very good morning to So myopia has emerged as a significant public health problem across the globe because there has been a rapid increase in the prevalence of childhood myopia in last few decades. And we all know that genetic factors play a significant role in myopia, but there are some environmental factors also which are found to be associated with lifestyle and which can impact the onset and progression of myopia. And there are positive longitudinal studies that may ascertain the effect of environmental factors on the myopia progression. So this study was done to determine the influence of time spent on outdoors by children in daylight on myopia progression by following these participants longitudinally. So it was a hospital-based longitudinal observational study done over a period of 2 years at a tertiary eye care center, where children with 6 to 14 years presented with decreased vision and children with myopia 0.5 or worse were included, and children with refractive error other than myopia and children with family history of myopia or anterior posterior segment disorders were excluded from the study. So total 580 children were enrolled. All children underwent cycloplegic refraction and glasses were prescribed. The spherical equivalent were calculated for all the children, and children were followed every 6 months for 18 months, and at every visit cycloplegic refraction was done at every visit and the spherical equivalent was calculated. The parents were asked to record the time spent in outdoor activity in daylight by child in hours per day at school, at home, during weekdays, weekends, separately on a calendar provided to them at the start of the study. And they were asked to bring this record at every follow-up visit. The time spent on outdoor activities in daylight was defined as like playing outside in the daylight, doing any activity, or even sitting in the daylight was considered as an outdoor, time spent outdoor. And this was calculated per day as the at every visit by dividing the total hours of outdoor activity in a week divided by 7. And the participants were divided into 4 age groups. This is the statistical analysis we followed for data analysis. A total of 495 participants out of 580 completed 3 follow-up visits during the study period. And this table shows the profile of all the participants, including the spherical equivalent and the outdoor activity in hours at baseline, as well as the 4 visits, the follow-up visits. Every time we calculated the outdoor activity as well as the spherical equivalent in all the participants. The inter and intra-individual association between the spherical equivalent and time spent outdoor in hours in 3 visits were determined by repeated measure correlation. And this was calculated as 0.26 and which showed statistically significant negative directional relationship between the outdoor activity and the spherical equivalent. This is the graph which shows a repeat measure correlation graph, which shows a statistically significant inverse relationship between the outdoor activity in myopia progression, and this line, dashed line, represents the overall negative correlation between these 2 observations. So the magnitude of relationship was determined by mixed effect model method also, which estimated the effect of per unit time spent outdoor to change in spherical equivalent in subsequent visits after adjusting for the baseline activity in the age. So each hour increase in outdoor activity per day, means extra hour spent outdoors, had a negative effect on change in spherical equivalent, which was 0.6 diopter on subsequent visits as compared to the last visits. So this 0.6 diopter may not be clinically significant, but statistically it was found to be very significant. So discussion, our study findings are closely in line with Sydney myopia study, which was a cross-sectional study, which suggested the protective role of time spent outdoor by children, 12 years of old children. Similarly, North India myopia study, the prevalence of myopia was significantly less in children who were playing 2 hours outdoor per day. And there's another study, Sherwin et al., which indicated 2% reduced odds of myopia for each additional hours spent outdoor. But all these studies were cross-sectional studies. Whereas our study was a longitudinal follow-up studies. So the mechanism underlying protective effect of outdoor activity and light exposure remains unclear, but there are studies which show that there is release of dopamine from the retina on response to daylight exposure. And this increase in dopamine level release inhibits the exit elongation of the eyeball. There are animal studies also to show that dopamine is released on daylight activity, and this decreases the exit elongation, which is responsible for decrease in progression of the myopia if the outdoor activity is there. So our study has multiple strengths and limitations. The strength is that there's a minimal recall bias, because all studies had a questionnaire-based recall, how many hours the child is playing outside. But in our study, we provided a chart to record the activity and bring it follow-up visits. So there are no recall biases in our study. It's a longitudinal study where we followed for 2 years. So there's a causal relationship can be established between hours spent in outdoor and progression of myopia. And it's a large sample size, 580 children were studied. Limitation that's institutional nature. We have hospital-based studies, so it cannot be extrapolated on the general population. So to conclude, increased hours of time spent on outdoor activity at home, school may be a simple strategy to prevent the onset and progression of myopia. So we can advise this can be additional to the other modalities of treatment which are going on to prevent progression of myopia like atropine therapy and all. So we can add this also to prevent the onset and progression of the myopia. And to our knowledge, this is the first hospital-based study which was done on cohort of children at tertiary care center in India. All studies in literature are cross-sectional studies, but we did a longitudinal study. These are references. Thank you.
Very relevant topic actually, seeing today's situation. But one factor which will be there in your study is that you have said, yes, definitely outdoor activity nowadays has a great role to play in this myopic
because
children.
now children have a screen time and they are
Yes,
not going outside.
but this is another factor which is going to affect the study. Like you have to even find out the screen time of these children. Because
the near activity.
Yeah, for near activity. Because nowadays we want children to go more into the outdoor activities. Okay, so the difference in the screen time of these children, if they are using the screens, most of them are actually using the screens, will be another point towards your results.
Yes.
You know, that might aggravate, that might remain the same.
Yes,
but
yes.
well presented and very relevant study.
Thank you so much. Thank you.
I've been a victim of this problem, but I would like to add here, not related to your subject. It's been a great help being this high myope after 40. That is why I never advise people LASIK or any other